Hello, and today we're going to talk about training in operations and administration. My name is Brian Yoon. I am the Vice Chair for Clinical Affairs at Boston Medical Center, and I am an Associate Professor at Boston University School of Medicine. I have no financial disclosures. Today we're going to go through a number of objectives. The first, understanding what are the potential pathways to train in operations and administration. Second, we're going to understand what are the foundational knowledge and expertise that one needs to develop in order to have a successful career in operations and administration. And finally, we're going to talk about some additional training opportunities that you can consider to help augment your expertise. When we talk about clinical operations, there are multiple pathways, and there's not a one right, correct pathway for a given individual. But when we talk about what are the two categories, we lump them into fellowship versus experience. Now, an important disclaimer anytime you talk about career pathways is beware of confirmation bias. We all like to share our life story because it helps confirm the pathway that we took. What's important and what I challenge you to do as you yourself decide whether or not you are going to embark in a career in administration operations is to talk to people in these fields and understand not only the pros but also the cons. It's important to understand the roses as well as the thorns. And this will help you then make an informed decision in terms of which pathway you will choose for yourself. Now, with that disclaimer, there are multiple things that you need to consider when you're trying to develop or to decide which pathway you'll take. The fellowship experience allows you to try out in a duty, a role or responsibility that during residency it is difficult to do. And fellowship experience also gives you an opportunity to lift off, whereas in the experience mode, you're most likely going to need to juggle a full clinical hour with the expectations of working full time. And that can cause a tug and pull between the 24 hours in a given day, 7 days a week that you have to hone your skills in operations. The other thing is understanding what the job market is in a given area. If you are in an area where many administrative fellowships exist, it can be difficult to try to get into a ground floor opportunity when there are a number of graduates coming from administrative fellowship programs. When you are also looking at whether not to consider the fellowship versus the experience pathway, the biggest question is, do you have access to mentors? These mentors are going to be critical, especially early on in your career, in one, learning from them, two, understanding how to map out your trajectory, and then three, developing an area of expertise that you could share and learn from the mentor. Finally, as you think about fellowship experience versus experiential learning, is the opportunity cost. There are 1-year fellowships, there are 2-year fellowships, and of course, starting off as an attending and learning from experience, they all have their costs associated with it. And specifically monetarily, we think about if you're doing a fellowship, you are postponing a year or two of an attending salary. But one thing to keep in mind is that with a career in administration and clinical operations, an area that you want to strongly consider additional training and getting a degree in is some type of master's degree in healthcare administration. Now, this certainly could be an MBA, this could be an MPH or equivalent. The cost is around $87,000 to $210,000 when you're looking at an executive MBA. Fellowships in general, the 2-year fellowships, will pay for this master's degree or help with the costs of developing this master's degree. And so one thing you should keep in mind is the fellowship salary plus the master's degree plus the pros outweigh the cost of delaying a year to 2 years of an attending salary. One thing that I'd like you to keep in mind is that more and more job descriptions of leadership positions are starting to state that they prefer a candidate with master's level training in healthcare administration or equivalent. And you can imagine in a number of years that this will be a requirement for a executive leader position. Moving on to training, as we think about what are the critical components you need to learn in order to be an effective leader, there's the foundation-based knowledge. And this can be developed by not only reading some important textbooks in clinical operations, but it's also applying what you read, applying what you learn. And that comes in 3 flavors. There will be emergency department committees, there'll be hospital committees, and then there'll be the ad hoc process improvement projects, which will either be a committee on its own or subcommittee. The main committees that you will come across and volunteer in or participate in are the Clinical Operations Committee, which oftentimes meets weekly. And this is where a number of the nitty-gritty details will be sorted out or protocols and policies will be approved. And then there's the Quality and Safety Committees, which you'll discuss or review how the department and the hospital are meeting certain objective measures. And then from there, you have specific areas of focused interest, which include stroke, acute coronary syndrome or STEMI committees, rapid response, of course the sepsis, and then utilization management committee. Each of you then should consider developing an expertise. Once you have that foundational knowledge, an area of expertise is important. And this is where identifying our mentor is critical, whether it's through your fellowship or through your department if you decide not to do a fellowship. And these areas of expertise include disaster, quality and safety, coding, billing, and compliance, and alternative care models including observation units or telehealth. An area of expertise is important because depending on where you are, whether it's an academic medical center or if you're trying to develop a career expertise, by developing an area of focus, it allows you to develop your academic credentials, but also then allows you to become a national expert or international expert in a specific area. Our last topic is just additional training opportunities that you want to do outside of fellowship or if you decide not to do a fellowship during your career as a faculty member. And these things are ED administrative leadership courses. There are a number of national, international leadership courses that you can search online. There are a number of business schools or school of public health that offer classes in negotiation. And then 2 areas that have become more and more used in medicine include behavioral economics and lean process improvements. There are countless others that we don't necessarily have the time to go into. But if you undergo a search, you can certainly look to see areas of outside of medicine that you can use and develop and learn these skills to apply to medicine. And that's where things get really exciting. I want to thank you for tuning in and listening, and we appreciate the time here, and I wish you the best of luck in your career in operations and administration.